Hi, good afternoon. My name is Milay Santana, and this will be my nurse head to toe assessment. This is a pan 360 of the room that I'll be working in. I will begin by washing my hands. Okay, I have washed my hands. I am knocking on the door and I am closing the door for privacy. Hi, my name is Milay. I'll be your nurse today. Can I please have your name?
My name is Michel Rafael Santana.
Can I please have your date of birth?
Date of birth 12/31/1978.
Okay, they both check out. Thank you. Can you tell me today's date?
Yes, June 3rd, 2026.
Okay, and can you tell me who the U.S. president is?
Donald Trump.
All right, thank you. Can you tell me, do you have any allergies?
No, I don't.
Okay. Do you have a job? Are you working?
Yes.
What do you do for a living?
I'm a general foreman for a sheet metal company.
That seems like a pretty dangerous job.
It can be.
Okay. How do you counteract the dangers of the job?
Well, I try to stay up with my OSHA requirements and regulations and keep up with my certifications, take some classes here and there.
Okay, all very good. Thank you.
No problem.
So quick question: do you exercise?
Not currently going to the gym, but I kind of exercise at work.
On your day to day, very
Yes,
a lot of walking.
Yes.
Okay, fair enough. Are you married?
Yes, I am.
Okay. If you have a problem that you need outside resources, who do you usually tend to go to?
Myself and my wife.
Okay, very well. What is your medical history?
Well, I suffer from high blood pressure.
Okay.
And I deal with high cholesterol here and there.
Okay. Do you know what medications you're taking currently?
Not really familiar with the name.
Okay. I took a look at your chart, and you are taking olmesartan hydrochlorothiazide, which is a combination of two different medications to help lower your blood pressure. And you're taking atorvastatin, which is Lipitor, which is for your cholesterol. Do you take anything over the counter?
Well, I take vitamins.
Okay, what vitamins do you take?
I take fish oil.
Okay.
And vitamin B6.
Okay.
I take an aspirin, a baby aspirin.
Baby aspirin. Okay, very good. Do you drink?
I do.
Okay, how often do you drink?
Weekends.
Okay,
Occasionally.
so socially.
Yeah.
Okay. Do you smoke?
No.
No smoking. Okay. Have you had any mood changes as of lately? Any
No.
anxiety, nervousness, depression?
No.
No. Okay. Have you ever thought of self-harming?
No.
No. Okay. Very well. So do you know why you're here today?
To do a head to toe assessment.
Yes, we're gonna look at all your body systems from head to toe, and I will ask you a series of questions as we go. I will explain everything to you. If by any chance you feel uncomfortable or in any pain, you let me know and we will work around that, okay? Are you in any pain right now?
No.
On a scale of 0 to 10, what's your pain level?
0.
0. Okay, perfect. Has pain ever gotten in the way of your daily activities?
Sometimes.
Pain, where would you have?
Knee, back.
Okay, so just kind of like the aging pains. Okay.
Yes.
All right, sounds good. Thank you. So we're gonna start now with your vitals. We're gonna check your respirations, your pulse oximetry, which tells me how you're oxygenating in your blood. We're gonna check your blood pressure, your temperature, and your pulse. Okay?
No
So
problem.
I'm gonna go ahead and put my gloves on. And again, stop me if you have any questions or if you have any pain or any uncomfortableness, okay?
No problem.
So we're gonna start right now with your respirations. Just, breathe normally. And I'll go ahead and measure that. So go ahead. And I see that he's breathing normally. Are you having any shortness of breath?
No.
Okay. I see the chest wall rising and falling equally. So since your rate is normal, I'm going to go ahead and count it for 30 seconds. I got an 8. We'll multiply that by 2 for a full minute. That is 16 breaths per minute. Your rate is normal, not fast. You're not in any distress. Next, we're going to go ahead and check your pulse oximetry, which, like I said, it measures the oxygenation in your blood. This goes over your finger. Thank you. Okay, and that is 99%, which is an acceptable, normal number, okay? Results.
Okay.
I'm going to go ahead and check your radial pulse. So just relax for me. I'm going to go ahead and count it for the full 30 seconds. Wow, very bounding. That means that it's strong. Okay. I don't feel any kind of palpitations. It's regular. Okay, this is a full 30 seconds, and I was able to get 34. So if you multiply that again by 2, which is for a full minute, that would be 68 heartbeat. Okay, your heartbeat, which is standard, it's normal. We're looking at it from anywhere from 60 to 100. Okay, so you're 68, so you're good. Next, I guess I'll check your temperature, and then I'll check your blood pressure last. Okay.
Okay.
So. All right, we got 97.5, which is, again, a normal reading. No fever, everything is fine. All right, now I'm going to go ahead and check your blood pressure. It's important to note that this is a standard adult size cuff, blood pressure cuff. I'm just going to lift up your shirt here. We're going to go ahead and do it on the right side. His arm, it's normal, it's standard. It's not too big, it's not too small, so this cuff is fine for him. Okay. So I'm gonna listen, okay? When I take your blood pressure, I'm gonna listen to your brachial artery, all right? We're gonna listen to that with the diaphragm of the stethoscope. Again, these instruments have all been cleaned prior to video. Okay, I'm going to go ahead and inflate the cup. Okay, that is 136 over 82. Perfect, thank you. Again, that is compatible with your high blood pressure. It's, I believe, stage 1 hypertension. So I'm going to put this here. I'm going to clean my stethoscope really quick. All right, so we've done all your vitals. We are moving on now next to your face, your nose, your mouth, your ears, and your neck. Okay, so first things first, I'm just going to inspect your face, making sure that there's no droopiness, that it's it's symmetrical. I'm going to look at your head as well. I'm going to have you look forward. And just look at the distribution of your hair. I'm going to palpate. Make sure that there's no lumps. Okay, no lumps. The hair distribution is about equal. There is some thinning here on the crown of the head. That could be compatible with, male baldness. Okay, you can lift up your head. Thank you. I'm gonna go ahead and check for cranial nerve 7 now. This is your facial nerve. This helps with the different facial expressions of your face. Okay.
Okay.
So I'm gonna go ahead and have you give me a smile, give me a frown, blow out your cheeks. Okay, very good. I'm gonna get a cotton swab and I'm gonna pass it around in your face. I'm gonna have you close your eyes, and when you feel it, just tell me now. Okay?
Okay.
Close your eyes.
No. 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 No.
Okay, very good. Thank you. Go ahead and throw that away. Next, I'm gonna check your temporal mandibular joint, which is located here. I'm gonna have you open your mouth, close it. Okay, good. And it's like a hard ball. What you wanna note is that there's no clicking, no popping, no grinding. Very good. I'm also gonna assess your cranial 5 trigeminal nerve. Can you bite down? Bite down. Good. Bite down. Very good. So here, bite down. I'm assessing the masseter muscles, the temporal muscles, and it feels like a hard ball, which is good. Okay, very well. I'm going to go ahead and put some pressure with my hand under your chin. I want you to try to open your mouth. Go ahead. Okay, good. Wow. Okay. I'm going to grab your chin, and I'm going to have you move your chin from left to right, side to side. Okay, good. Okay, perfect. Thank you. He's able to follow all the commands, so obviously these cranial nerves are intact. Very well. I'm going to go ahead and inspect your nose now, okay? So we're looking at the contour of the nose, the symmetrical shape. Have you had any discharge, bloody noses?
No.
No? Okay. I'm going to take my pen light, and I'm going to check inside your nose, okay? Little light. So I'm looking for any polyps, any drainage. I see that his septum is nice and midline. It's not deviated. I'm going to have the patient, I'm going to have you do me a favor and close one of the sides of your nose and take a deep breath, okay? And either one, you can start with the left one if you'd like. So just put a finger there and occlude it and breathe in and out through the right ear. And so that's what you're listening for, right? Like the airflow, no obstruction. Good. Can you do it on the other side now? Airflow, no obstruction, no difficulty, correct? Okay, very well. I need you to close your eyes. I'm going to give you something to smell, and you have to tell me what you smell, okay?
Okay.
All right, I'm going to bring it up to your nose. Okay. Yeah, that elicits your mouth, right? Like it elicits. Yeah. What does it smell like?
Vanilla.
Vanilla, and it is vanilla. It's vanilla extract. Thank you. Okay, so that's the nose. We're moving on now down to the mouth. We're gonna take a look at your mouth. Let me get my little pen light again. We're looking at the lips. They're nice and pink. No cracked lips. They're nice and smooth. Those are indications that you're hydrated. You know, you're drinking enough water, etc., etc. So I'm gonna have you open your mouth, stick your tongue out. Okay, the tongue is nice and pink, no striation, no ulcers. Okay, you can stick your tongue back in, open your mouth again. I'm looking at all the teeth. You don't wear any implants or any dentures, excuse me. Okay, he has all his teeth, nothing's missing. I see the mucosas are nice and pink, no ulcers. The gums are nice and pink. Okay. All right, very well. Thank you. I'm going to go ahead and take off my gloves as we move on. Just going to clean my hands with this antiseptic. So far, so good?
Yes.
Okay. You're doing great.
Thank you.
All right. So now we are doing the ears, okay? Now, doing what you do, which I know it's hazardous, and do you wear any protective hearing?
Yes, earplugs.
Okay, have you noticed your hearing changing or?
I'm getting older now, so maybe a little bit.
A little bit?
Yeah.
Okay. Have you had any formal testing done or anything
No.
like that? Okay. So it's something that you might want to bring up to your primary.
Okay.
Okay. So I'm gonna look at the ears. I'm gonna palpate them. I'm gonna tug at them, pull on them, check the targets. No discharge, normal coloration. You haven't had any traumatic experiences with your ear. I'm gonna check the mastoid process back here, make sure that there's no swelling and it's nice and intact, no swelling. Any pain when I pull?
No.
No? Okay. So the ears are good. One thing I want to check is your beard, because your beard is kind of out there, okay? So I'm just going to take a look at your beard. Normal distribution of hair, very well. Okay. I'm taking advantage because he doesn't let me touch his beard. Okay, sorry. Okay, good. All right, no lumps, no nothing. All the hair seems to be in place. Good. All right, so now we're gonna move on to your eyes. Okay. Do you wear glasses?
I do.
Is it because you need them to read, or is it to read?
Glasses.
So reading glasses.
Yes.
Okay, good. All right, perfect. So you only wear them just to read, not to
Yes.
now on the day to day.
That's correct.
Okay, perfect. So now I'm just gonna inspect your eyes. I'm gonna look at them. I see that their pupils are nice and round. They're about a 3 millimeter in size. Your scleras are white. I'm gonna go ahead and test for reaction to light. Okay. Just bear with me because it's a little strong. Let me just make sure this is clean. All right. So just look at me, and I'm just testing your pupils that they react. Okay, good. Okay, good. Now I'm gonna test for accommodation. So you're gonna look, you're gonna focus on my nose, and I'm gonna bring the pen light to you, to the middle of your nose, okay? So actually look at the pen light as I drive it towards your nose, okay?
Okay.
And what we're looking for is constriction, which there is. So very good. So your pupils are equal, they're reactive, they do accommodate, and they're round, okay? So all very good. Now I'm gonna check your conjunctivae. Pardon me, it's not said correctly. I'm gonna just pull down on your lids, okay? And I notice that you don't have any strabismus or any ptosis of like lid drooping or anything like that. So I'm just gonna pull down. Okay, good. And they're nice and pink and moist. Very well. And again, you haven't had any drainage or any accidents or anything like that. Okay, perfect. Thank you so much.
No problem.
We're now going to do the confrontation test. And this, what it does is that it assesses your periphery vision. So our vision is very narrow here, but then it opens up as a cone as we expand the object. So I'm going to have you cover your left eye. And I'm going to cover my right eye. Okay? And we're going to split your vision into 4 quadrants, right? I'm going to introduce my fingers. I'm going to wiggle them. And when you see them wiggling, you tell me now. Okay? I'm going to start now.
No. 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 No.
Very good. Now I'm going to have you cover your right eye. And I'm going to cover my left eye. Okay? And we're going to do the same thing. We're going to split the vision into 4 quadrants, and I'm going to introduce the stimuli. Alrighty?
No. 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 No.
Okay, very good. Alright, so now we've done your head, we've done your cranial nerves, your eyes, your nose, your lips, your ears. Now we're going to move on to your neck, okay? Here I am going to assess your trachea. I'm going to have you tilt your head back. So we want to make sure that the trachea is midline. We're looking for contour and symmetry, okay? Making sure that there's no goiter, there's no lumps, you know, anything that would raise alarms as to something else going on. So I see that his trachea is nicely aligned midline. I'm gonna go ahead and palpate it. Okay. Okay, very well. Can I have you just swallow? Good, and that trachea went right upward, okay? So that's good. Thank you. I am also gonna assess some glands in your neck. I need you to tell me if you feel any tenderness while I'm assessing them, okay? So we're gonna start here with your tonsillar lymph nodes. Then we're gonna move on to the submandibular lymph nodes. Then we're gonna do the submental, which is right under the chin, okay? Then we're gonna move down to your anterior cervical lymph nodes. Then we're gonna do the posterior lymph nodes. Can I have you undress yourself a little bit, just the top portion? Because I'm gonna listen to lungs and your heart.
No problem.
Thank you. And I'm just gonna expose you here. We're doing the the posterior lymph nodes. Okay, I'm gonna do the occipital, which is behind your neck. Then we're gonna do the subclavicular lymph nodes and the clavicular lymph nodes, yeah. Okay, good, thank you. You can cover yourself up for now. So what we're looking for is making sure that the lymph nodes are movable, that they're not tender. So did you have any pain while I was doing this?
No, I do not.
You did not. Okay, great. All right, so I'm gonna go ahead now and assess your carotid artery, since we're already in the neck. Okay, so I'm going to grab my stethoscope again. It's already been cleaned. I'm gonna grab my stethoscope. Well, first, I'm gonna just feel for it.
Okay.
Now, it's important for you not to feel at the same time because you may get lightheaded and you might piss out on me. So we're gonna do one and then we'll compare it to the other side. Okay, so I'm gonna start with your right. Wow. Very bounding. +3. Very strong. Okay, good. Now I'm gonna compare it to your left. Also very bounding. Awesome. Thank you. All right. So now I'm going to go ahead and listen to your carotid, okay? So for this part of the exam, we're going to go ahead and use the bell portion of the stethoscope, okay? So I'm going to listen to your carotid here. I'm going to ask you to take a deep breath, let it out, hold it. Okay, thank you. Same thing over here. I'm going to assess your carotid. I'm going to have you take a deep breath. Let it out. Hold it. Okay, perfect. So we're assessing here for no bruits, no adventitious sounds, no bruits. So he had no bruits. So good. Let me clean this again. So we're done with assessing your neck. We've done your cervical lymph nodes. We checked your carotid, and we did your trachea. So now we're moving down to your chest. Okay, so here we're gonna check your heart sounds. Okay. All right. I'm gonna undress you a little bit. Sorry. This is fine. This is fine. I'm gonna move your chain a little back. Okay. Thank you. All right. So here we listen with the diaphragm of the stethoscope, and we're listening to all the valves. Okay. So we're listening to 5 of them. We're listening to the aortic valve, pulmonic valve, Erb's point, tricuspid, and mitral. So in the mitral valve, this is where you would listen for the apical pulse for a full minute. Okay, so I hear the lub dub dub, S1, S2, no murmurs, nothing that indicates any issues, okay? So we're good there. Next, I'm gonna check some of your, let me just put this here because I'm gonna continue using it. I've already checked your radio, so I'm gonna check your ulnar pulses. Okay. I would say a +2, normal. I'm gonna check your brachials. This is the one that I used when I took your blood pressure earlier. Okay. I would say also +2. I'm gonna check your temporal artery, which I didn't check when I was doing your face, but I'm gonna go ahead and check it now. Okay, very well. I will check your femoral, your popliteal, and your pedal pulses as we move down with the assessment. Okay. So now next we are going to do your thorax, your lungs. We're going to listen to lung sounds, okay? Anterior in the front and also posterior in the back. For the posterior, I'll just have you stand up because I have to do a few things back there, okay? So let's start with the front first. Now with this assessment, you're going to do a lot of breathing, you know, so that I can listen to a full cycle of you breathing in and breathing out, okay?
No problem.
Sorry.
It's okay.
All right. So for this exam, we also again use the diaphragm of the stethoscope. So we're gonna listen up here. Take a deep breath. Okay. Good. Take a deep breath. Good. Deep breath. Deep breath. Deep breath. Now we're listening for any adventitious sounds, crackles, rails, wheezing. So far, take a deep breath. Okay, very good, thank you. So far, just normal breath sounds, no crackles, no wheezing. These are all breath sounds that you would hear if you were having issues with your lungs. If you had narrowing of the airway, like constricted airway, like in asthma patients, somebody with fluid in their lungs, that type of patient. But everything sounds clear. Okay, thank you. I'm gonna have you stand up.
Yes.
And while we're looking at the chest, I'm looking at the skin, right? The skin color, which is normal for his ethnicity, hair distribution. It looks like you shave or wax.
Yeah.
Okay, so his hair is minimal right now, but yes, it's equal. It's normally distributed. Okay, so I'm gonna have you here. If you can drop your shirt a little bit for me. That's good. Okay. So now I'm going to listen to him posteriorly. All right, take a deep breath. Good. And these are the apexes of the lungs. Now we're going to assess the upper lobes. And we're always comparing. Deep breath. Now we're checking the lower lobes. Okay, very well, thank you. Just keep your shirt off for just a second. Here we're gonna look at his back. Make sure again the skin color is well for his ethnicity, no broken skin, no lacerations, no scratches. Hair again is dispersed equally. So yes, thank you. Put your shirt back on. Thank you, sir. I'm gonna go ahead and clean my stethoscope. And I'll be changing my gloves. Next, we're gonna move on towards your abdomen. Okay, we've checked lung sounds. We checked your artery, your arteries on the top. We're gonna go ahead and check. We checked your lungs. Actually, stand back up for me. I forgot one thing. We gotta check for vocal fremitus. Okay, I'm so sorry.
It's okay.
Okay, let's clean. Some hand hygiene. You're doing great, okay? Alright. So while I have you standing up, I am going to go ahead and have you turn around again. Drop your shirt just a tad. And we're gonna go ahead and check for vibrant, the fremitus, okay? So I'm gonna go ahead and place my arms here. I'm gonna have you say 99.
99. 99. 99. 99. 99.
Okay, thank you. We could percuss also the back. We're checking for dullness, resonance. So okay, perfect. Thank you. So resonant. There was vibration. All normal findings. Okay, you can put this back. Well, just leave it off just in case I have to check anything else. I'm gonna have you get under the covers. We're gonna go ahead and move down to your abdomen. Okay, so we can do that now. Oh, you need the pillow, sorry. Go ahead. Okay, so you gotta make sure that your patient is properly. I'm gonna have you lift your shirt, okay? You lift up. Okay, perfect. So we gotta make sure that the patient's draped correctly, just exposing the abdomen. Here we're gonna look, we're gonna listen, we're gonna feel, and then we're gonna percuss. Okay? When was your last bowel movement?
Early as born.
Okay. Are you having any issues with urinating, with your stream?
No.
Okay. Any concerns? Any any gastro issues?
No.
No. Okay, so I'm inspecting the abdomen right now. Again, it's a normal color for his ethnicity. I don't see any protruding veins or anything. No distension. Everything looks normal. No masses. No hernia. So I'm gonna go ahead and listen. Okay.
No problem.
Quick question. How do you check? Do you check your testicular for testicular cancer? Obviously, you have to check your testicles every month. Is that something that you do?
Not regularly.
Not regularly. Okay. So It's important for you to check because you have to make sure there's no masses, no tenderness, pain, no lumps. The best time to do it is usually after a warm shower or bath. You stand in front of a mirror, you use both hands, and you check both testicles, okay?
Okay.
So you gotta make it a point to check it. Just like women check, we check our breasts, men need to check their testicles. All right?
Thank you.
And you're welcome. All right, so we listen to the abdomen with, again, the diaphragm portion of the stethoscope. I'm gonna start with the right lower quadrant and work myself clockwise. Okay, right upper. Ooh. Left upper. And left lower quadrant. Okay. I was able to listen. There's activity. It's not hyper active, but it's not hypoactive. It's normal bowel sounds. Okay. Thank you. I'm gonna go ahead and clean my stethoscope. Alrighty. Alright, so next we've done auscultating. We're gonna do some light palpation. So this is just basically feeling around your stomach. You let me know if you feel any tenderness or pain. Okay?
Okay.
Anything?
No.
Okay. Now we're gonna do deep palpation. If you're strong enough, you can do it with one arm. I like to do it with two. So you just take this and go like that. And palpate, palpate, palpate. And there's no masses. I don't feel anything out of place. No pain.
No.
Okay. Now we're gonna percuss. Remember that you have your spleen on your left hand side and you have your liver on the right hand side. So we're gonna go ahead and something to bring up, his umbilicus is also midline. Also, it looks fine, no, nothing protruding. So we're done with the abdomen. Thank you. All right, I'm going to now check his musculoskeletal, his skin. Like I said, I've been looking at his skin. It's even, it's fine for his ethnicity. I don't see anything broken, any lesions. Lift up your left arm for me. I'm gonna look at your arms, your hands, make sure there's no clubbing. I'm looking at his peripheral capillary refill. Perfect, nice and brisk. His nails are pink and clean. Just moving everything. Looking at his muscle symmetry, nice muscle symmetry. I'm looking at your shoulder, making sure, do you have anything in your shoulder? No? No heat, no pain. Nice and smooth. Looking at your elbows for no heat, no swelling. Nothing's broken in the skin. Thank you. And look at your right. Check your capillary refill. Nice and pink. And check your skin turgor. Whoop, it goes right back. That's just to see if you're dehydrated. Somebody that would be dehydrated. Usually the elderly population, you see them pinch the skin and it kind of stays like a tent. Okay? Because they don't get as much water as we do. So muscle symmetry, nice and equal. We're gonna look at the elbow, no heat, nothing broken, no swelling. Again, look at the shoulder, no heat, no swelling. Okay, perfect. Thank you. I am now gonna assess the femoral artery. I'm gonna assess it under the covers just because it's very deep and in your groin. So you have femoral arteries that are very deep in your groin. So I'm gonna go ahead and assess it now, okay? It won't be on camera. Although deep, I feel it. It's bounding. Thank you. Okay. I'm gonna go ahead and expose your legs.
Mhm.
All right, so we're looking at muscle symmetry. Got nice legs.
Thank you.
So his muscles are nice and equal. Okay, wiggle your toes for me. Lift up your left arm. I mean left leg. Lift up your right leg. Thank you. Okay, hair distribution is nice and equal, just like in the arms. Nice distribution, nice and equal. No missing patches. Let me look at your heels. Okay, no redness, no breakage. Okay, nice smooth plantars. Okay, checking your capillary refill. Nice and brisk. All right, I'm gonna check your popliteal artery, which is behind your knee. So I'm gonna have you flex your knees, bring them up. Thank you. These are deep too. Sometimes you gotta look for them. Okay, I'm able to feel them, nice and two, both of them. Thank you. I'm looking at the knees, making sure there's no heat, no breakage, no lesions in the skin. Palpating them. They feel fine. Any pain? No? Okay. All right. I'm going to have you push against my hands. Very well. Now I'm going to have you lift up against my hands. Good. I'm going to have you try to lift your legs against my resistance. Go ahead. Okay, good. Good job. Thank you. I think this is it. Oh, wait. I have to check my pedal pulses. So we have pulses in the feet. We also have to check. I noticed that his skin is nice and warm. Okay. Nice color, movement, sensation. Let me check sensation really quick. So with sensation, we're going to use this little toothpick. I'm going to have you close your eyes. And I'm going to go ahead and prick your skin. And when you feel it, say now. Okay?
Mm-hmm. No. 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 No.
Okay?
No. No. No.
Okay. Thank you. All right. So back to the pedal pulses. I am going to go ahead and check the dorsalis pedal first. This is on top of the foot right here. Oh, wow. Nice and bounding. I say this is a 3. They're strong. Very strong. And then I'm going to check the posterior tibs, which are in the inner part of your ankle. Equally strong. I would say a 3. Very bounding. Very well. Thank you. I am going to have you sit up and actually stand here while I assess your gait. Your gait is basically the way you walk. I'm going to be looking for your coordination of your arms, the coordination of your feet, any disbalance or anything like that. So I'm going to have you stand there. I'm going to have you walk towards me. Again, we're looking at the way he positioned his feet, his arms swinging, any kind of disbalance, any kind of, okay. Good. Let me just walk out here for a second. Okay, so now we are going to do the Romberg's test. So I'm going to have you face the camera this way. We're going to put your feet together. Okay, and we're going to close your eyes for about 30 seconds. It's just to make sure, and I'm going to stand close to you. It's just to make sure that you don't have any kind of disbalance. You're not going to fall when you have your eyes closed, because that triggers like some sort of like vestibular issue. Okay, which is with your ears and the way you stand, okay?
Okay.
Can you sway a little bit to the left? A little to the right, back, and forward. Okay, perfect. That is a negative Romberg's test, sir.
Thank you.
I want to tell you thank you for your time and for being my specimen.
No problem.
I appreciate it. Yeah. And thank you, Professor Oles. This is my head to toe. I hope you've enjoyed it. I'm going to go ahead and stop it, and I'm going to go wash my hands. Thank you.